Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Bharat N. He has done MD in pediatrics, and after that he has done the fellowship in neonatology, and now he is working in Chinmaya Mission Hospital, Bengaluru, and he is a very popular neonatologist. Today he is going to tell us about the stories of umbilical cord and importance of the umbilical cord and how to take care of it. Welcome, Dr. Bharat.
Thank you, madam. Thanks for the introduction. Yes, we are going to talk about umbilical cord care today. So the story of umbilical cord begins before birth. As you know, the connection between mother and baby is through umbilical cord, which will be attached to the placenta. So the function of this umbilical cord is to provide nutrition as well as oxygen, and sometimes, yes, not just sometimes, it is to remove some waste products as well from the baby. Yes. So there will be a continuous blood circulation which will be happening through this umbilical cord.
Yeah, when you said the circulation, I remember being a cardiologist, that too a pediatric cardiologist, the fetal circulation, the pure blood goes through the vein, umbilical vein. Yes. There is one vein. And that is the mother's pure blood goes to supply oxygen as well as the nutrition to the baby, all the tissues. And unwanted things, the waste has to be thrown. And that comes out of through umbilical veins. And this is just opposite of what happens in our real life. See, yes, the arteries carry the pure blood and the veins carry the impure blood, but here it is the reverse.
Yes, yes, exactly, madam. And as you know, that as there is a blood flow which is happening, any problem with this umbilical cord can have detrimental effects on the baby. So that's why nowadays they measure this blood flow through this umbilical cord, be it in artery, like especially in the artery, they measure blood flow. If there are problems in blood flow through this umbilical artery, then it indicates that baby is being compromised. Yes. So those are the things. That's why it is important.
We also know when we are doing the fetal echo, before going to the heart examination of the heart, we first look at the arteries and the umbilical cord and how the flow is, whether there is any resistance, whether there is any impedance, everything is calculated there. Yes, you're right.
Yes. So before birth, that is the importance. At birth, what we do is delayed cord clamping, means immediately after birth, we do not cut this umbilical cord, rather allow the blood supply to happen from placenta to baby. WHO recommends to delay the cord clamp for 1 minute. After that, we usually clamp cord and then provide whatever care the baby is needed.
And before clamping, you do the blood inside it, so that push it back. Yeah, sometimes because that contain the stem cells, which is very important for the hemopoietin. Yes.
Yes, ma'am. So that is called umbilical cord milking. Yes, in some cases, umbilical cord milking is done. And after birth, probably if baby is in NICU, we do use this umbilical cord sometimes to give blood transfusion, or to give nutrition, or to sometimes even remove blood. Yeah. So these are the ways help, or that's the help that umbilical cord is doing.
So that means it acts like a lifeline even after the birth. Not only it's a lifeline inside the mother's womb, even afterwards. Because I remember for my own grandchild when he had a very severe jaundice, and they gave the exchange transfusion through the umbilical vessels. So that is a very important one. Yes.
Yes. Very important. And it is very important to take care of this umbilical cord. Yes, exactly. It helps in taking blood, so which is a painless one. So many blood tests can be done by removing blood from this. So
and also to detect the thyroids in the thyroid test.
Thyroid levels, blood grouping. So many tests can be done through this umbilical cord. And it has to be, this is important because it is prone to develop many other complications. So usual question that the parent asks is, what should I do to this umbilical cord? So my suggestion will always be to keep this cord dry and clean.
Don't do anything. Keep it clean.
Keep it clean and dry.
Not to meddle with that. Yes.
Yes. The more you touch the more will be the chance of infection. If it is
Correct.
if it is infection, things will get complicated. So keep it dry and clean.
Yeah,
When I say
when you said infection, I remember I got a 3 months old baby with the tachypnea and a very sick child. And when I did the echo, I was shocked, shell shocked. There was a huge mass, almost 2 to 3 centimeters of wobbling inside the right side of the heart. And that was the fungal ball. The fungus had gone through the umbilical vessel because they had treated and IV fluids were given. I don't know whether it is a contaminated fluid or what it is. The infection had come through that. So this is a lesson not only for the parents, for the nurses and the doctors, whoever is touching the umbilical cord, they have to have the asepsis completely. Yes.
Definitely, madam, because that's why we usually care for, like, we take utmost precautions while touching umbilical cord. And the next thing is what to do. Yes, keep it dry and clean. And if at all, if the umbilical cord is going into diaper, it should not go into diaper. It should stay away out of diaper. So hence, it will reduce contamination from both urine and stool of the baby.
Okay.
And the other common things is, when will it, common questions that the parents ask is, when will this cord fall? So the usual timeline would be to wait for 10 to 14 days. Sometimes it may take up to 3 weeks.
Even up to 21 days we can, yeah.
Yes. If sometimes it might get prolonged, at that time you might have to visit your pediatrician. So the reasons for delayed cord are many. One such is infection. So umbilical cord infection, sometimes granuloma can be present.
What is this granuloma and what is the umbilical hernia? Please tell us.
These are the swellings which we see around umbilicus or in the umbilical area. So umbilical granuloma is nothing but a pink tissue which will be persistent once the cord falls. So when we see a pink tissue, which will sometimes be covered with a yellow material, but not much of pus that we see around this, no pus, but a yellow material, not pus, that we call it as umbilical granuloma. And this is around 10 to 20% of the patients do come back to us saying that there is some material which we see, some pink material which we see, for which we advise to apply salt. Application of salt will be very much helpful in these cases.
Yeah, rock
and
salt.
If not, rock salt. And if not, probably we'll do silver nitrate cauterization. And the next thing is umbilical hernia. When I say umbilical hernia, this is also a protruding mass.
Like a bulging. Something is bulging at that area.
Yes.
Like
Exactly.
a mass. Yeah.
Like a mass. Hernia, as you know, hernia is something which bulges. So when the baby cries or coughs, there will be a bulge from umbilicus to outwards, which if you press, it will go inside.
Yeah.
The contents will be
Especially
usually
in the premature babies, it is more common, no, doctor?
most common is in premature as well as low birth weight babies. So we usually don't treat this. We reassure parents that as the baby grows, baby will put on muscle, and the defect which is there will usually close by 1 year.
It will become small. Yeah.
Usually be closing by 1 year. And in fact, till 4 to 5 years, it will not be operated even if it is present. After 4 to 5 years, or if there is a complication, then usually
or if it is increasing in size, then we can handle.
Yes. So only at that time the surgeons operate, if not. So this is about the main difference between umbilical granuloma and umbilical hernia. And another common thing is sometimes there will be bleeding once the cord falls. There will be slight bleeding, so which doesn't require any intervention. Again, the rule is keep it dry and clean, nothing else to be done. But if bleeding is persistent or profuse, you might have to visit your pediatrician, definitely.
Okay. So nicely you have explained everything. Finally, what is the advice that you would like to give to the parents?
Yes.
Finally.
The final advice will be keep it dry and clean. The cord should be dry and clean. Even after birth, it has its function. So keeping it clean is of utmost importance. And don't panic, because this is the problems related to umbilicus. The only time you will panic is when there is infection. The rest others,
Yes.
90 to 95% of the time, it can be handled. Uh, it can be handled sometimes at home, like minor bleeding, or sometimes a pink material which is there, where we usually advise to apply rock salt like that. Yes. So that will be the take.
This is a very, very important advice you have given, because any infection in the umbilical cord, directly it goes to the heart, because that is the root inside the intrauterine fetal circulation. And that's how, one has to be very careful with the infection or a pus or anything occurring in that. So thank you very much, Dr. Bharat, for giving so beautifully narrating the story of umbilical cord from the intrauterine life to after birth. Thank you.
Thank you. Thank you.